So the topic of this talk is about comparing evaluation of quantitative imaging methods using reference standards versus regression without truth-based techniques. Let me start with some background about quantitative imaging. Quantitative imaging is the procedure to extract numerical or statistical features from medical images to help with clinical decision making. For example, determine the metabolic tumor volume impact to predict cancer therapy response, mirror dopamine transporter uptake in SPECT to assess severity of Parkinson disease, quantify intratumor heterogeneity in CT to predict cancer treatment outcome. For reliable feature quantification, multiple new quantitative imaging methods are being developed. These methods include such as image reconstruction methods, post-processing approaches, image segmentation methods, and so on. For clinical translation of these methods, one key question is to evaluate these methods using patient data. For example, consider that while quantifying metabolic tumor volume impact here, for this purpose, we need to segment out the tumor, and there are multiple different segmentation methods available. Each of these methods will yield a different set of metabolic tumor volumes. So that one key question is that which segmentation methods will yield the most reliable MTV quantification? So to conduct this evaluation with patient data, the problem is that we do not have the ground truth. Consider that if we have the ground truth, one thing we could do is that we can do a simple linear regression, where then we can estimate the slope of bias and noise standard deviation terms between the estimated value and the true value. And then we can use the slope and the bias terms to calibrate the measurement. And then we can see that the calibrated measurement equals to the true value plus some noise term. And the noise term is zero mean with the standard deviation given by the original standard deviation divided by the slope term. And we can see that this noise term is the part that we can really note eliminated or calibrated, so that we could possibly use this noise standard deviation as the figure of merit to compare these different methods based on precision. However, in reality, we do not have ground truth to compare with. Normally, what we can use is the reference standard, which is defined as a well-accepted method, but we know that there is associated bias or measurement error. In this case of comparing different segmentation methods, physician delineation could be one of these, could be the reference standard. However, even for obtaining this reference standard, the process could be expensive and time-consuming. And even we can obtain these reference standards, they still suffer from inter-reader and intra-reader variability. For example, here is the true tumor boundary on the reconstructed PET image. And because of the limited resolution and the partial volume effect, one physician might give a larger delineation, and the other physician might give a smaller delineation. This inaccurate segmentation can result in error in the quantitative measurement, which might affect the comparison of these different methods. So consider that here, while using the reference standard as a surrogate for the true value, and we do the linear regression with the reference standard, and we can see that there are errors in the estimated slope, bias, and noise standard deviations, thus which might further affect the comparison of these three different methods. In the context of that the ground truth is not available, there is another set of regression-without-truth techniques that have been proposed. These techniques compare the quantitative imaging methods using only the measurement of these methods. And in previous study, they were observed to yield unbiased estimates of the noise-to-slope ratio. Let us see how this technique works. If we have the true value, what we can do is this simple linear regression, but since now we do not have the true value, these techniques assume that the true value are sampled from some parametric distribution. And with this assumption, this technique is able to estimate the slope, bias, and noise standard deviation terms using some maximum likelihood estimator. To further understand how this technique works, let me provide some intuition here. Consider that the true value is described by some parametric distribution, and based on the linear relationship between the measurement and the true value will first be scaled by a slope term and then shifted by a bias term, and finally it will be corrupted by a noise term. So that we can see that the true value distribution can the distribution of the measurement can actually be characterized by the true value distribution parameters and the linear relationship parameters. Now consider that we have these three different methods that are measuring the same underlying true value, so that we can characterize the distribution of these three different methods using the true value distribution parameters and all the linear relationship parameters. And consider that these three different methods are measuring the same underlying true value, the noise between them could be correlated. So we can also characterize the noise term using a multivariate Gaussian distribution. Now with this, we can estimate the linear relationship parameters using a maximum likelihood estimator without access to the true value. And then after this estimation, we can use the noise-to-slope ratio to compare different methods based on precision. This method have been showing promise in different applications, including comparing segmentation methods, reconstruction methods for different modalities, including PET, SPECT, and MRI. So with these promising results, recall that if we do evaluation with the reference standard, there might be error in estimating those linear relationship parameters. So that inspires the question that how does evaluation using the regression without truth technique compare to evaluation with reference standard? To analyze this question, we considered a numerical study, where in this numerical study, we can control that all these linear relationship assumptions are satisfied. So in this study, we first generate a set of true quantitative values from a known parameter from a known 4-parameter beta distribution. And then we can generate measurements of 3 hypothetical quantitative imaging methods using a known linear relationship parameters. Using this measurement, we can do evaluation using regression without truth. On the other side, we can generate a reference standard by adding a zero mean Gaussian noise term to the ground truth. Now, with this reference standard and the measurements, we can do evaluation using a reference standard. The good part with numerical study is that we actually know the true value of the linear relationship parameters, so that we know the true ranking of these 3 hypothetical quantitative imaging methods. So with that, we can repeat the whole process for a certain number of times. For example, here we repeat it for 50 realizations. And then we can compute the percentage for correctly ranking these 3 hypothetical quantitative imaging methods. We repeated this process for different numbers of the samples and different level of noise in the reference standard. Now let us first look at the results for evaluation using reference standard. And we can see that with the increase of the noise in the reference standard, the percentage for correctly ranking these 3 hypothetical quantitative imaging methods decreased. And now let us see the results for regression without truth. And we can see that it can actually outperform the evaluation with reference standard for certain noise levels. So in the clinic, sometimes we also cares about only identify instead of ranking all these 3 different methods. The purpose is to identify the best method. So here we also look at the percentage for correctly identifying the most precise method. And we can observe similar results here. Now with this numerical study results in place, we wonder that will we observe similar results in more clinically realistic settings? So next, we conducted this analysis in a virtual imaging trial. In this virtual imaging trial, we'll consider evaluating image segmentation methods on the task of quantifying tumor area. First, we generated a large 2D PET image dataset using a well-validated stochastic and physics-based PET simulation strategy, where we inserted a high-resolution tumor into patient background. With this inserted tumor, we can obtain the true value of the ground truth of the tumor area. And then to obtain the reference standard, we simply perturb the true tumor contour using erosion and dilation operations. There is the one example here. The green line is the true tumor boundary, and with this erosion operation, we can see that it is a smaller delineation comparing to the true tumor boundary. And here is the example with the dilated tumor boundary. With these reference tumor boundaries, we can obtain the reference standards of all the tumor areas. To compare these different PET segmentation methods, here we consider the three different PET segmentation methods. The first one is the traditional active contour-based method called SNACES. And the second one is the UNet-based method, which simply classifies each pixel as belonging to either tumor or background. And the last one is the recently proposed eSegNet method, which estimates the tumor frictional area within each pixel. With this, here is an example of using these three different methods for segmenting out the tumor in one of the PET images here. With these three different methods, we can obtain all the measurements for the tumor areas. And then what we can do is we randomly sample a certain number of images with corresponding ground truth measurements and reference standards from this large PET image dataset. And then we can first do evaluation with ground truth, which provide us with a benchmark and then we can do evaluation using regression without truth and evaluation using reference standard. Again, by repeating this for a certain number of trial instances, we can obtain the percentage for correctly ranking the methods and identifying the most precise method. Now let us first see the results for evaluation with ground truth. And we can see that SNACES is having the largest noise to soup ratio, so it's the least precise one. And then, although you can see that UNet and eSegNet, the noise for them that the noise to soup ratio is pretty close, but actually UNet is consistently having a larger noise to soup ratio comparing to eSegNet. So eSegNet is the most precise one here. Now let us see the results for evaluation with reference standard. Here is that all the reference standards are eroded. And we can see it's still keeping a consistent evaluation results comparing to evaluation with ground truth. However, when all the reference standards are dilated, we can see that it sometimes ranks UNet as the most precise one, but sometimes ranks eSegNet as the most precise one. So it's kind of messed up between these two methods. We also consider cases that some of the reference standards are dilated, some of the reference standards are eroded. And here we can see the estimation of the noise to soup ratio is already very different from evaluation with ground truth, and it's hard to compare these three different methods here. Now let us see the results for regression without truth. And we can see that regression without truth is consistently yielding the same ranking performance as comparing to evaluation with ground truth. We also conducted analysis for different numbers of images here, which is different numbers of samples here. And we can see for if all the reference standards are eroded, it's not having a much effect in these cases. But if it's dilated with the amount of dilation increases, we can see the performance for correctly ranking the methods decreased. Also, for the cases that some of the reference standards are eroded, some of the reference standards are dilated, the performance is also decreased. However, in this case, we can see that regression without truth can help here. So we can see that it can actually outperform the evaluation with reference standard, and it also improves as the number of images increases, and it finally achieves 100% ranking accuracy. Aside from looking at the task of quantifying tumor area, we also look at the task for quantifying mean regional activity uptake here. So let's again first see the evaluation with the ground truth. We can see that snakes is having the largest noise to super ratio, so it's the least precise one, and then UNet and then E-segment is the most precise one. Let us first see the results for evaluation using reference standard also. So again, if all the reference standards are eroded, we can see that it's not having a large effect on ranking the methods. But if all the reference standards are dilated, we can see now it's consistently ranking UNet as the most precise one, and the E-segment is less precise than UNet. Also, for the case that some of the reference standards are dilated, some of the reference standards are eroded, it's hard to compare these three different methods here. So we can see the error in the reference standard can actually affect the estimation of the noise to soup ratio, which will lead to inaccurate method comparison. Now let us see the results for evaluation using regression without truth. Now we can see that again, it's consistently yielding the same ranking results comparing to evaluation with ground truth. Also, for different numbers of images here, we can see that regression without truth can actually outperform for some of the evaluation using reference standard. For evaluation with reference standard, we can see the ranking performance can actually decrease a lot with the amount of the dilation increased. And in this case, regression without truth can really help to provide a method to compare these different methods here. So to conclude that in this analysis, we find that error in the reference standard can potentially decrease the accuracy for ranking the different methods, different quantitative imaging methods. And in this case, regression without truth shows improved ranking performance with increase in patient sample size, and it can potentially serve as a viable alternative when ground truth is unavailable. We have some trade-offs in this study. First, we use the synthetic lesion instead of real lesions because we need the ground truth to provide a benchmark to compare evaluation with reference standards and the regression without truth here. Also, we computationally generated reference standard instead of using manual delineation because we wanted a controlled setting so that we can systematically vary the reference standard error and quantify its impact on evaluation accuracy. So, one direction for the future study is to compare the regression without truth with the evaluation using more realistic reference standards such as manual delineation. With that, I'd like to thank all the collaborators, the lab members, and the funding agencies.